What is the primary function of the cornea in the eye? A. Focusing light onto the retina. B. Producing tears to maintain moisture. C. Regulating the amount of light that enters the eye. D. Protecting the eye and helping to focus light. The correct answer is D. Pause. The cornea is the clear outer layer of the eye that protects it and helps to focus light onto the retina. What is the main function of the cochlea in the human ear? A. Balancing. B. Detecting sound waves. C. Regulating pressure. D. Controlling eye movement. The correct answer is B. Pause. The cochlea is the part of the inner ear that detects sound waves and converts them into nerve signals that are sent to the brain. Which of the following is a function of the olfactory nerve? A. Regulating taste perception. B. Detecting odors. C. Maintaining balance. D. Controlling eye movement. The correct answer is B. The olfactory nerve is responsible for detecting odors and transmitting that information to the brain. Which of the following structures is responsible for taste perception in humans? A. Cornea. B. Cochlea. C. Taste buds. D. Semicircular canals. The correct answer is C. Pause. Taste buds located on the tongue are responsible for detecting different tastes such as sweet, sour, salty, and bitter. What is the main function of the Eustachian tube in the human ear? A. Detecting sound waves. B. Regulating pressure. C. Balancing. D. Controlling eye movement. The correct answer is B. The Eustachian tube helps to regulate air pressure in the middle ear, preventing damage to the eardrum and ensuring proper hearing function. Which of the following is a common disorder of the eye characterized by blurry vision due to the irregular shape of the cornea? A. Pink eye. B. Cataracts. C. Astigmatism. D. Glaucoma. The correct answer is C. Astigmatism is a common eye disorder where the cornea has an irregular shape, causing blurry vision at varying distances. Which part of the ear is responsible for maintaining balance and spatial orientation? A. Cochlea. B. Eustachian tube. C. Semicircular canals. D. Auditory nerve. The correct answer is C. The semicircular canals are part of the inner ear that help to maintain balance and spatial orientation. Which of the following conditions is characterized by a persistent ringing or buzzing sound in the ear? A. Vertigo. B. Tinnitus. C. Otitis media. D. Presbycusis. The correct answer is B. Pause. Tinnitus is a common condition where individuals experience a ringing or buzzing sound in their ears, often due to underlying hearing loss. What is the function of the mucus in the nasal passages? A. Detecting odors. B. Balancing. C. Producing tears. D. Filtering and humidifying air. The correct answer is D. Mucus in the nasal passages helps to filter and humidify the air we breathe, trapping particles and keeping the nasal passages moist. Which structure in the eye contains the photoreceptor cells responsible for detecting light and color? A. Cornea. B. Retina. C. Lens. D. Iris. The correct answer is B. Break. The retina contains photoreceptor cells, rods and cones, that detect light and color, converting them into electrical signals that are then sent to the brain for processing. What is the primary function of the semicircular canals in the inner ear? A. Hearing. B. Balance. C. Taste perception. D. Smell detection. The correct answer is B. The semicircular canals are responsible for maintaining balance and spatial orientation in the body. Which of the following is a common disorder of the ear characterized by inflammation or infection of the middle ear? A. Glaucoma. B. Otitis media. C. Cataracts. D. Tinnitus. The correct answer is B. Otitis media is a common ear disorder characterized by inflammation or infection of the middle ear. What is the function of the ciliary body in the eye? A. To detect light and color. B. To focus the lens. C. To produce aqueous humor. D. To control pupil size. The correct answer is C. Pause. The ciliary body's main function is to produce aqueous humor, a fluid that helps maintain the eye's shape and nourishes the surrounding tissues. Which part of the tongue contains taste buds that detect sweet, salty, sour, bitter, and umami flavors? A. Filiform papillae. B. Fungiform papillae. C. Circumvallate papillae. D. Foliate papillae. The correct answer is C. Circumvallate papillae are larger papillae located at the back of the tongue and contain taste buds responsible for detecting different flavors like sweet, salty, sour, bitter, and umami. What is the role of the macula in the eye? A. To detect color. B. To control eye movement. C. To provide central vision. D. To produce tears. The correct answer is C. Pause. The macula is a small area near the center of the retina that provides sharp, central vision. Which of the following is a common disorder of the eye characterized by clouding of the lens, leading to blurry vision? A. Astigmatism. B. Macular degeneration. C. Cataracts. D. Conjunctivitis. The correct answer is C. Cataracts are a common eye disorder where the lens becomes cloudy, causing blurry vision and can lead to blindness if left untreated. What is the function of the Eustachian tube in the ear? A. To help detect sound waves. B. To equalize pressure. C. To protect the eardrum. D. To amplify sounds. The correct answer is B. The Eustachian tube helps equalize pressure between the middle ear and the atmosphere, preventing discomfort and allowing the eardrum to vibrate freely. Which of the following is a disorder characterized by the loss of the sense of smell? A. Cataracts. B. Conjunctivitis. C. Olfactory dysfunction. D. Presbyopia. The correct answer is C. Olfactory dysfunction is a disorder where an individual experiences a loss of the sense of smell, which can be temporary or permanent and often affects taste perception as well. Which condition is characterized by abnormal pressure equalization in the middle ear, leading to symptoms like ear pain and hearing difficulties? A. Otitis media. B. Conjunctivitis. C. Glaucoma. D. Macular degeneration. The correct answer is A. Pause. Otitis media is a common disorder of the ear characterized by inflammation or infection of the middle ear, resulting in symptoms like ear pain and hearing difficulties. Which structure in the eye is responsible for producing aqueous humor, a fluid that helps maintain the necessary pressure and nourishment for the eye? A. Iris. B. Ciliary body. C. Retina. D. Cornea. The correct answer is B. The ciliary body in the eye is responsible for producing aqueous humor, which helps maintain the necessary pressure and nourishment for the eye. Which disorder of the eye is characterized by damage to the optic nerve, often leading to vision loss and blindness if left untreated? A. Glaucoma. B. Otitis media. C. Tinnitus. D. Conjunctivitis. The correct answer is A. Pause. Glaucoma is a common eye disorder characterized by damage to the optic nerve. Pause. If left untreated, it can lead to vision loss and blindness. Which part of the ear is responsible for converting sound waves into electrical signals that are transmitted to the brain for auditory processing? A. Cochlea. B. semicircular canals. C. Eustachian tube. D. Tympanic membrane. The correct answer is A. Pause. The cochlea in the ear is responsible for converting sound waves into electrical signals that are transmitted to the brain for auditory processing. Which common disorder of the eye is characterized by the gradual loss of central vision due to damage to the macula, the part of the eye responsible for detailed central vision? A. Macular degeneration. B. Glaucoma. C. Conjunctivitis. D. Otitis media. The correct answer is A. Pause. Macular degeneration is an eye disorder characterized by the gradual loss of central vision due to damage to the macula, the part of the eye responsible for detailed central vision. The sensory receptors for taste are located in which specific structures on the tongue? A. Taste buds. B. Papillae. C. Filiform papillae. D. Fungiform papillae. The correct answer is A. The taste buds on the tongue contain sensory receptors responsible for detecting different tastes like sweet, salty, sour, bitter, and umami flavors. Which of the following is a common disorder of the ear characterized by a feeling of fullness or pressure in the ear, along with muffled hearing? A. Eustachian tube dysfunction. B. Conjunctivitis. C. Glaucoma. D. Macular degeneration. The correct answer is A. Eustachian tube dysfunction is a common ear disorder characterized by a feeling of fullness or pressure in the ear, along with muffled hearing. Which structure in the nose is responsible for detecting olfactory stimuli and transmitting them to the brain for smell perception? A. Olfactory epithelium. B. Septum. C. Nasal conchae. D. Turbinate bones. The correct answer is A. The olfactory epithelium in the nose contains the sensory receptors responsible for detecting olfactory stimuli and transmitting them to the brain for smell perception. Barotrauma is a condition commonly associated with which part of the ear? A. Middle ear. B. Inner ear. C. Outer ear. D. External ear canal. The correct answer is A. Break. Barotrauma is a condition commonly associated with the middle ear, occurring due to abnormal pressure changes in the ear. What is the primary function of the iris in the eye? A. Regulating the amount of light entering the eye. B. Detecting color and shapes. C. Supporting the eye structure. D. Producing tears. The correct answer is A. Pause. The iris controls the size of the pupil. Pause. Which in turn regulates the amount of light entering the eye. Which of the following is a common disorder of the ear characterized by vertigo, a sensation of spinning or motion when no actual movement is occurring? A. Meniere's disease. B. Presbycusis. C. Tinnitus. D. Conductive hearing loss. The correct answer is A. Pause. Meniere's disease is a disorder of the inner ear that can lead to episodes of vertigo, hearing loss, tinnitus, and a feeling of fullness in the ear. What is the function of the lacrimal gland in the eye? A. Producing tears. B. Supporting eye movement. C. Regulating pupil size. D. Detecting visual stimuli. The correct answer is A. The lacrimal gland is responsible for producing tears, which help keep the eye moist and protect it from foreign particles. Which of the following is a common disorder of the nose characterized by inflammation of the nasal passages, causing symptoms like nasal congestion, runny nose, and sneezing? A. Sinusitis. B. Rhinitis. C. Epistaxis. D. Anosmia. The correct answer is B. Rhinitis is the inflammation of the nasal passages and is commonly known as a runny nose or nasal congestion. What is the function of the ossicles in the middle ear? A. Conducting sound vibrations. Pause. B. Producing ear wax. Pause. C. Maintaining balance. Pause. D. Detecting odors. The correct answer is A. The ossicles, malleus, incus, stapes, in the middle ear transmit sound vibrations from the eardrum to the inner ear. Which of the following is a common disorder of the eye characterized by increased intraocular pressure, leading to damage to the optic nerve and potential vision loss if untreated? A. Glaucoma. B. Cataracts. C. Strabismus. D. Astigmatism. The correct answer is A. Pause. Glaucoma is a group of eye conditions that damage the optic nerve due to increased pressure inside the eye. What is the function of the vestibular system in the inner ear? A. Maintaining balance and spatial orientation. B. Detecting loud noises. C. Producing ear wax. D. Converting sound waves into electrical signals. The correct answer is A. The vestibular system in the inner ear helps maintain balance and spatial orientation by detecting head movements and changes in gravity. Which of the following is a common disorder of the tongue characterized by small, painful ulcers that can make eating and talking uncomfortable? A. Glossitis. B. Halitosis. C. Leukoplakia. D. Athos ulcers. The correct answer is D. Less than break time equals 0.5 s greater than. Athos ulcers, also known as canker sores, are common tongue disorders characterized by small, painful ulcers that can occur on the tongue and inside the mouth. What is the function of the nasal conchae in the nasal passages? A. Warming, humidifying, and filtering the air we breathe. B. Detecting odors. C. Producing mucus. D. Conducting sound vibrations. The correct answer is A. Pause. The nasal conchae help warm, humidify, and filter the air we breathe before it reaches the lungs, improving respiratory efficiency. Which of the following is a common disorder of the ear characterized by the presence of fluid behind the eardrum, leading to hearing difficulties and discomfort? A. Otitis media. B. Cholesteatoma. C. Presbycusis. D. Otosclerosis. The correct answer is A. Pause. Otitis media is an ear infection that commonly involves the presence of fluid or pus behind the eardrum, causing hearing difficulties and discomfort. Which structure in the eye is responsible for detecting light and color? A. Cornea. B. Iris. C. Retina. D. Lens. The correct answer is C. The retina is the structure in the eye that contains the photoreceptor cells responsible for detecting light and color. Which disorder of the ear is characterized by inflammation or infection of the outer ear canal? A. Otitis media. B. Otitis externa. C. Tinnitus. D. Meniere's disease. The correct answer is B. Otitis externa is a common disorder of the ear that is characterized by inflammation or infection of the outer ear canal. What is the primary function of the semicircular canals in the inner ear? A. Maintaining balance. B. Sound transduction. C. Producing earwax. D. Pressure equalization. The correct answer is A. The semicircular canals in the inner ear are responsible for maintaining balance and spatial orientation. Which of the following is a common disorder of the nose characterized by the inflammation of the mucous membranes lining the nasal passages, leading to symptoms like nasal congestion and runny nose? A. Sinusitis. B. Rhinitis. C. Epistaxis. D. Anosmia. The correct answer is B. Rhinitis is a common disorder of the nose characterized by the inflammation of the mucous membranes lining the nasal passages, causing symptoms like nasal congestion and runny nose. What is the main function of the lacrimal gland in the eye? A. Produce tears. B. Control pupil size. C. Refraction of light. D. Produce aqueous humor. The correct answer is A. Pause. The lacrimal gland is responsible for producing tears, which help keep the surface of the eye moist and clean. Which of the following is a common disorder of the eye characterized by clouding of the lens, leading to blurry vision? A. Glaucoma. B. Macular degeneration. C. Cataracts. D. Diabetic retinopathy. The correct answer is C. Cataracts are a common disorder of the eye characterized by the clouding of the lens, resulting in blurry vision. What is the role of the macula in the eye? A. Detect light and color. B. Maintain balance. C. Provide detailed central vision. D. Produce tears. The correct answer is C. Pause. The macula is the part of the eye responsible for providing detailed central vision. Which of the following is a common disorder of the ear characterized by the sensation of ringing or buzzing in the ear, often caused by exposure to loud noises or underlying health conditions? A. Meniere's disease. B. Tinnitus. C. Vertigo. D. Otitis media. The correct answer is B. Pause. Tinnitus is a common disorder of the ear characterized by the sensation of ringing or buzzing in the ear, often associated with exposure to loud noises or other health conditions. What is the primary function of the pupil in the eye? A. Regulate the amount of light entering the eye. B. Detect colors. C. Produce tears. D. Detect odors. The correct answer is A. Pause. The pupil controls the amount of light that enters the eye by dilating or constricting in response to light intensity. Which of the following is a common disorder of the ear characterized by a buildup of wax that can cause hearing difficulties? A. Otitis media. B. Tinnitus. C. Meniere's disease. D. Cerumen impaction. The correct answer is D. Less than break time equals 0.5 s, greater than cerumen impaction, or earwax buildup, can lead to hearing impairment and discomfort. What is the primary function of the uvula in the human throat? A. Filter air. B. Produce speech sounds. C. Prevent food from entering the nasal cavity during swallowing. D. Initiate the gag reflex. The correct answer is C. The uvula helps prevent food and liquids from entering the nasal cavity during the swallowing process. Which of the following is a common disorder of the eye characterized by inflammation of the conjunctiva, leading to redness and discharge? A. Glaucoma. B. Conjunctivitis. C. Cataracts. D. Macular degeneration. The correct answer is B. Conjunctivitis, also known as pink eye, is a common eye infection causing redness and discharge of the conjunctiva. What is the function of the cochlear nerve in the human ear? A. Balance and spatial orientation. B. Hearing. C. Connect the ear to the brainstem. D. Produce earwax. The correct answer is B. Pause. The cochlear nerve transmits auditory information from the cochlea of the inner ear to the brain for hearing perception.